Today, we are going to look at a BodyViz brain builder about the cranial nerves and Bell's palsy. There are 12 pairs of cranial nerves that are visible on the ventrolateral surface of the brain. These 12 pairs of cranial nerves exit the brain and leave through fissures in the foramina of the skull. All of the cranial nerves are distributed to the structures within the head and/or neck, except for the 10th cranial nerve, which supplies structures within the thorax and abdomen. Cranial nerves are numbered by Roman numerals as one progresses rostrally to caudally along the ventral surface of the brain. Let's learn the name of each cranial nerve and their respective Roman numeral. 1. Olfactory. 2. Optic. 3. Oculomotor. 4. Trochlear. 5. Trigeminal. 6. Abducent. 7. Facial. 8. Vestibular cochlear or auditory. 9. Glossopharyngeal. 10. Vagus. 11. Accessory or sensory. And lastly, 12. Hypoglossal. There's a popular mnemonic device that can be used to help memorize the cranial nerves and their Roman numerals. On old Olympic towering, top of Finn and German, viewed some hops. This interesting and odd little phrase can be extremely helpful in memorizing the names and Roman numerals of the cranial nerves. Let's take a closer look at the 7th cranial nerve, also termed the facial nerves. The 7th cranial nerves emerge from the brain between the pons and the medulla oblongata as two divisions: the primary root, also termed the facial nerve proper, and the intermediate nerve. The facial nerve carries nerve fibers that control facial movement and expression. The facial nerve also carries nerves that are involved in taste to the anterior 2/3 of the tongue and the production of tears. Idiopathic facial palsy, also known as Bell's palsy, is a form of temporary facial paralysis or weakness on one side of the face, resulting from a dysfunction of the 7th cranial nerve. The term idiopathic refers to a medical condition or disease of unknown origin that arrives spontaneously. Hence, there is little known regarding the origin of the temporary unilateral facial paralysis known as Bell's palsy. Cranial nerve 7 is the most frequently paralyzed nerve of all 12 cranial nerves. The areas affected by paralysis of the 7th cranial nerve depends on the portion of the nerve involved. Next, we will look at the symptoms, causes, and treatments for Bell's palsy, and finally, look at a patient example. Symptoms of Bell's palsy include mild, severe, or total paralysis to the muscles on one side of the face, resulting in muscle weakness and facial distortion. This usually looks like drooping of the mouth and/or the inability to completely close one eye, excessive tearing of the eye on the ipsilateral side of the face, altered taste, and the inability to tolerate loud noise due to paralysis of the stapedius muscle. As mentioned earlier, the cause of Bell's palsy is not known. However, Bell's palsy is sometimes associated with the following: diabetes, high blood pressure, injury, toxins, infection, especially following a viral infection with herpes simplex virus, and other diseases. Treatment for Bell's palsy typically includes administration of oral steroids, eye protection at night to minimize irritation or drying due to the patient's inability to completely close the affected eye, lubricating eye drops, administering of painkillers such as ibuprofen, acetaminophen, or aspirin to relieve any pain, physical therapy, and/or facial massage. Generally, 85 to 90% of Bell's palsy patients demonstrate spontaneous and complete recovery within 3 weeks of the appearance of the initial symptoms. Some patients, however, will demonstrate some form of permanent facial paralysis for the remainder of their lives. Finally, let's take a look at a patient example. You receive your patient's file and take a look. Age, 28. Sex, female. Chief complaints, dripping on the left side of the patient's face and the left eye watering. You invite the patient into your office for an examination. You ask your patient when they first started noticing the facial droop and watering of the eye. They explain how they woke up yesterday and thought they looked different when they were looking in the mirror while brushing their teeth. When they were at work, they began drooling, and then they had to keep a tissue nearby to wipe away the excess water from their left eye. Upon further examination, you notice complete paralysis of the muscle group on the left side of your patient's face. You explain to your patient what Bell's palsy is and how there is no known cause as to why it occurs, but most patients experience a complete recovery within 3 weeks of its onset. You prescribe oral steroids and recommend they wear eye protection at night, since they are unable to completely close the left eye. Your patient also begins physical therapy that includes electrical stimulation to help stimulate the nerves and muscles of their face. This is a classic example of Bell's palsy. Thank you for watching this Brain Builder video. Please like and subscribe to our BodyViz channel. Or, if you are new at BodyViz, check out our other anatomy resources and schedule a demo at bodyviz.com.